The Child Welfare Community Collaborations to Strengthen and Preserve Families Initiative, or CWCC, was funded by the Children's Bureau. The Children's Bureau is an agency within the U.S. Department of Health and Human Services, Administration for Children and Families, or ACF. The CWCC initiative was designed to mobilize communities to develop and evaluate collaboratives that address local barriers and provide services to prevent child abuse and neglect. To advance the evidence around collaborative approaches to primary prevention, ACF's Office of Planning, Research and Evaluation, or OPRE, contracted with App Global and Child Trends. Together, they conducted a cross-site process evaluation documenting grantees' experiences and programmatic strategies. The evaluation included site visits with 405 in-depth interviews and 1,720 collaboration surveys with CWCC grantees and their partners, as well as a review of grantee documents. Overall, the evaluation found that CWCC projects achieved several key successes in advancing the initiative's goals. In particular, CWCC projects engaged a wide range of partners, integrated multi-level strategies, used data to support project implementation and evaluation efforts, and plan to sustain the strategies implemented. Overall, grantees engaged a wide range of partners with each grantee, partnering with 20 organizations on average. Community-serving organizations comprised roughly half of the partners across all projects. They included behavioral, physical, and mental health specialists, concrete services providers such as food or housing providers, and community-based nonprofits. Partner organizations also commonly included public agencies or offices, such as legal system and social service agencies. To a lesser extent, grantees also partnered with philanthropic and business organizations and educational organizations. Grantees also implemented a range of integrated multi-level strategies. All of the CWCC projects included at least one individual-level strategy focused on supporting parents or families. For example, family coaching and navigation services were the most common individual-level strategy. All projects also included at least one community-level strategy focused on raising the community's awareness of existing supports and meaningfully engaging the community in the design and delivery of prevention services. For example, staff and provider trainings and community outreach were the most common community-level strategies. Finally, all projects also included at least one systems-level strategy aimed at facilitating collaboration across the systems that support children and families. For example, these systems alignment activities often included data sharing. CWCC projects used data to support project implementation and evaluation efforts designed to contribute to the evidence base for primary prevention. All 13 CWCC projects used data to identify communities and families in need of prevention services. For example, projects used child maltreatment data, community demographic data, and needs assessment surveys to decide where to offer services, who to offer services to, and how to identify and recruit families to participate. Projects also use data to identify the strengths and needs of families served. For example, by administering surveys and assessments to families to understand their protective factors and mental health. Data also helped projects to make informed decisions about service provision. For example, projects used community needs assessment surveys to identify gaps in services and partners who could address those gaps. Projects also used program participation and referral data to determine what services to offer, both to the community overall and to specific families. Additionally, projects use data to inform continuous quality improvement, for example, by measuring fidelity or satisfaction. And lastly, all projects use data to measure and report on project outcomes at the individual, community, or systems level. Interviewees plan to sustain almost all of the strategies they implemented through their CWCC projects in some capacity. While the number of projects implementing each strategy varied, overall, interviewees reported plans to sustain 99% of the strategies implemented in some capacity. The cross-site process evaluation also identified the following 6 key lessons that can potentially serve as guiding principles for other communities seeking to implement collaborative prevention projects. Interviewees emphasized the need to: first, build trusting relationships with partnering organizations, families served, and community members. Second, ensure that collaborating organizations have dedicated resources to support their participation in the project. Third, use data to drive decision-making, including partner selection and implementation, and build the case for sustainability. Fourth, engage individuals with relevant experience, especially experience with the child welfare system, in the design, implementation, and evaluation of strategies, and value them as equal partners. Fifth, establish clear communication and coordination between collaborating organizations. And sixth, be flexible and tailor services to the specific needs of families. These lessons are explored in depth in a series of cross-site evaluation products. You can find a high-level overview of the initiative, key evaluation findings, and lessons learned in the executive summary. Additional background information is available in the introduction brief and the evaluation design and methods brief. To learn more about what grantees did and key lessons learned, review our briefs on implementation strategies, approaches to partnership, data use, and plans for sustainability. Finally, you can learn more about each of the individual grantees in our Projects at a Glance brief. Explore the full series of cross-site evaluation products at the link in the video description.